How much does a 510K cost? That's a question that almost every startup company asks us. How much is it going to cost me? They want to know. And how long does it take? And usually the answer consultants give is it depends. But to give you some ballpark numbers, that's what this video is for. First things first, how much does the FDA charge? They charge $19,870 for their standard fee. You will be eligible for a small business fee. That's a $14,903 discount if you apply, if you make less than 100 million. But you have to apply, and I have another video for that. So go watch the other video if you want to apply for small business status and save yourself almost $15,000. If you don't, hire us and we'll find some other way to save you some money. If you are familiar with our website, we have Medical Device Academy logo. We've also had the FDA eCopy logo in promoting eCopy services. However, the FDA has announced that they are eliminating the eCopy service, and it will have to be an eStar submission by October 1st, 2023. So we have 1 year transition here, and we've updated our logo. We have the little dead USB from the eCopy process in his little coffin going to a better place. And now you can submit your eStar through the customer collaboration portal instead. So that means electronic submissions, 100% electronic, no more trips to the FedEx office to send off your submission. So they can receive it same day and process it same day. Next slide here. These are the user fees. So if you were submitting a de novo instead, there's prices for that. It's $132,464 for the standard fee and $33,116. The prices for other types of submissions went up approximately 17.8%. The establishment registration went up a little less than 15%, but the 510K fee went up over 55% this year. And that's where the bulk of their work is located, so that's where they're increasing it. There is no discount for the establishment registration either. That's an important point. But if you have not submitted a 510K yet, and you don't have a device that is 510K exempt, you shouldn't be paying that yet. Next slide, annual establishment registration. When you go to pay your user fee, it asks you, are all your current annual establishment registrations current? That's only for companies that already have a 510K. If you don't have a 510K, you don't have any establishment registration fees that are due, so you don't have to pay that and your 510K user fee. You do not pay your user fee unless you already have other products. I'm sorry, you don't pay your annual establishment registration user fee unless you already have other 510K products on the market or you have exempt products that are on the market. The reason why they put that question there is you are not able to pay your user fee for a 510K if you haven't already paid your annual establishment registration and you have other products that are already on the market with 510Ks. For the submission preparation, this is what Medical Device Academy does. Our consultants on the team, they prepare your submission, whether it's a 510K or a de novo, and we charge the same amount for both types of submissions. The base fee is $17,500. Now, if you think your submission, oh, ours is really, really simple, it won't take any time at all, and we've done most of the work for you. First of all, you just jinxed yourself when you said we've done most of the work, because everybody that has said that, it's been nowhere near almost done, and it's actually taken longer to undo a lot of their mistakes. So hopefully that is not you, but that happens a fair amount. When we start these submissions, we could do this on an hourly basis. We have another slide that tells you what our hourly rates are and tells you what the deposits are for the hourly. But most of the companies that have never done a submission before, they need a lot of additional consulting services. And so our goal was to try to set a price that is fair and would be approximately what we would charge on an hourly basis. You want to work on an hourly basis? That's not a problem for us. We'll do that too. If you want to do a pre-sub, that typically hourly actually ends up being more than $3,500 unless we've already done a pre-sub before for your company in the past, and we're just revising some documents and submitting a supplement. So supplements I would always do on an hourly, but if it's a brand new pre-sub, probably better off with a 3,500 flat fee for that pre-sub, but it does not include identifying the pathway, predicate selection, and testing plan. You might be lucky and you might be making a surgical mass and we know what the answers are and don't need that. We also wouldn't need a pre-sub in that case. But if it's something that's a complex electromedical device, you're probably going to need a testing plan. If you don't already have one, we charge for that, and that's in addition to the pre-sub preparation. So those are our submission fees. So now you know the FDA's fees and our fees. If and I forgot to mention, if you are going with somebody other than the FDA, so there are third-party reviewers that do the work instead of the FDA, then recommend it be 510K cleared to the FDA, and the FDA does a 30-day quick review to make sure everything's in order before they make their final decision. In those cases, you're paying your fee directly to the third-party reviewer, and the only one we recommend is RTS because they're the only one with lots of experience and significant amounts of data to show what their turnaround time is on them and how successful they've been. So we work with RTS a lot. They've done over 1,500 submissions. This is right on their website on the front page. They also list all the 510Ks they've recently gotten cleared, and it's all public knowledge. So that's definitely a great way to go if your 3-letter product code is eligible, but it does come at a premium. There's no small business discount, and they charge approximately 6% more than the standard fees. So whatever the standard fee is now, 19,870. Add 6%, and that's what it should be for RTS. Our hourly rates. If you hire me, it's $350 an hour. If you're hiring Mary, Sharon, or Matthew, who are not the owners of the company, it's $275. They don't have all the job duties of an owner, and they have a lot more time available generally than I do. So generally, you will be assigned to one of them. Bhumika, will be promoted fairly soon once she gets her 5th 510K cleared. She's done a great job on the 510K she has done, but I wanted to wait until she had 5 under her belt before we jumped it up to the normal senior regulatory consultant rate of $275. And then if you are doing hourly consulting projects, we ask for a $2,800 deposit, and we submit monthly invoices. And at the end of the project, we subtract the deposit from the last invoice. The reason for this is we work with startup companies, and occasionally they go out of business and leave us with a bill that they didn't pay. So the deposit discourages that and gives us a little less loss if that last bill is $5,000–6,000. But we try to send the invoices when it hits $5,000 or monthly. And the deposit's $2,800. I came up with that number. It's 8 times my $350 per hour. So that's why that is that number. But we need some kind of a deposit. If you are doing a very small project, we could make that like a let's say it was a pre-sub. We could make that deposit smaller. But our standard deposit, if you're working on a 510K, would be $2,800. Then for the testing costs, this is the big dollar item. It's not the FDA fees. It's not our fees. It's not going to be pre-sub fees. All those things are cheap in comparison to this list. The first bullet, biocompatibility alone, if you just have something that only touches the skin and it's intact skin and it's short term, it's still going to cost you the same amount as a 510K preparation or a 510K user fee. And if you have a small business discount, it's going to cost you more than that. And that's just one bullet point. The sterilization could cost you that much. Shelf life testing could cost you that much. Software validation will probably cost you more than that. Even if you do it in-house and you pay your workers very little money, it will still probably cost more than that. Electrical safety and EMC testing could easily be over 50 grand and usually is. Benchtop performance testing, if you did that in-house, it could be less, but the equipment that you need to do the benchtop performance testing probably costs more. Animal performance testing, add a zero. So that's going to be 100,000, $250,000 kind of range. And if you need to do human clinical performance testing, it's probably going to be a minimum of $250,000 up to millions of dollars for a clinical study. It all depends on how many follow-up visits you need, whether you need imaging data, and how many subjects. Those are the primary drivers of your human clinical costs. So the testing costs are the most important thing. And the reason for a pre-sub is so you don't have to repeat any of those. And everybody claims, well, I don't want to do a pre-sub. How can we avoid a pre-sub? It's for your benefit. It's to keep you from spending money on tests and having to repeat them, or submitting, not having all the testing present, having them tell you in an AI letter, you have 180 days to do this test, and you're unable to make enough samples and get the testing completed within the 180 days. Not every testing company is just waiting around for you to send them samples. They have a queue, and you might not be able to get in there for 8 to 12 weeks. And then if you have an 8 to 12 week test, you could be very close to that deadline already. If you're going to do an SIR meeting, a submission and review meeting, to ask about the testing, then get in the queue, and then do the testing, you're not going to make it in 180 days. And that happens time and time again. So the purpose of a pre-sub is to nail down exactly what tests are needed so you don't have to repeat any of the tests, and so you're not missing any of the tests and have your submission automatically withdrawn because you didn't respond to AI requests within 180 days. So that's everything that's related to testing. In terms of cost, though, it's sort of a high-level view of where the costs are, but the bulk of your testing, the bulk of your dollars is in your testing. That's the bulk of your time. I actually did 5 submissions in a week. Bhumika helped me with the 6th one. We got it all done in a week. It isn't the preparation time, it's the testing time. And the reason why we were finishing things on the 30th of September, because people hadn't gotten test reports yet. So when people don't have test reports yet, it's kind of hard to submit. That's the number one thing you need to pay attention to, is how long do the tests take, and how much do they cost, and everything else is less important. Not important, just less important. If you have any questions, don't hesitate to contact me, and you can schedule an appointment using the calendar link. Thank you. Have a great day.